So welcome to anyone who's joined us online for this presentation by the Flinders Northern Territory Regional Training Hub. Tonight we're presenting a Career Pathways webinar featuring the Australasian College for Emergency Medicine. We're using the Zoom webinar software. So we are running this as a webinar style. So anyone who's attending with us online, you'll be able to see and hear the presenters, but you'll be unable to be heard or seen yourselves. However, we have enabled the chat function for you. So you can introduce yourself via the chat function and all of the panelists will see that you're out there, and you can ask us questions, particularly by putting your questions into the Q&A box, which you can see with the 2 speech bubble icon at the bottom of your screen today. So feel free to use that chat function to interact with us and pop your questions into the question and answer icon, and we'll get to the Q&A session after our presenters have spoken. This session is going to be recorded and will be edited and shared on the Flinders NT Regional Training Hub website later, so available for everybody to view at a later date if you happen to miss something this evening or you want to share this with somebody else. I would like to acknowledge the traditional owners of the country that I'm currently broadcasting from today and pay my respects to the Larrakia elders, past, present and future, who are the traditional custodians of the land from which me and my team are broadcasting from today. I'd also like to acknowledge the Wurundjeri people of the Kulin Nations, from where one of our speakers, Heather Chapman, is broadcasting from in Melbourne, and the Wurundjeri people of Albury-Wodonga country, where Matthew is joining us from as well. So we've got a multicultural event this evening, and I'd like to pay my respects to everyone else who's joining us from different lands right across the country. We are going to have 4 presenters this evening, all representing the Australasian College for Emergency Medicine, then the Q&A, and then we'll sum up and say goodbye, and we'll exit with a quick poll to get some feedback from our attendees. So I'm very proud to be facilitating this series of medical career pathway webinars as a collaboration with Flinders NT Regional Training Hub, Top End Health Services, the specialty colleges and well-respected NT clinicians. Today, as I said, we're joined by the Australasian College for Emergency Medicine to promote emergency medicine training pathways in the NT for clinicians and to create a dynamic and sustainable workforce for Territorians. There are great opportunities for clinicians wanting to explore a career in emergency medicine in the NT, including those passionate about Aboriginal and Torres Strait Islander health. So tonight we're joined by Heather Chapman, a training and selection coordinator for the college, Matthew Davies, a manager of national programs, who's going to tell us about some exciting initiatives that are happening, I believe, Dr. Thomas Van Danzig, who's a current trainee in the Top End, and Dr. Rebecca Day, who's the co-director of the emergency medicine training at Top End Health Services in the NT. I'm going to stop sharing my screen now and give my team a couple of seconds to change our view. And then I'm going to gladly, with not much further ado, hand over to Heather Chapman and Matthew Davis from the Australasian College for Emergency Medicine and let them take it away and tell us about all the exciting things we need to know. Thank you, Heather.
All right, so hi everyone, thank you for joining us. As Olivia said, my name is Heather Chapman. I'm Selection and Training Coordinator at ASIM, and I'm just here to give you an overview of the emergency medicine specialty, the placement training program, and the application process to join the college. So first of all, why emergency medicine? It's important to know that it's not for everyone. It suits people who enjoy shift work and acute patient care rather than long-term involvement in cases. And it's well suited to those who enjoy a fast-paced environment that requires you to make quick, accurate, on-the-spot decisions. It is something, there's heaps of variety, and I know it's sort of a cliche to say that no day is the same as the next, but with emergency medicine that really is true. The generalist nature of the specialty does allow you to draw on any knowledge you've acquired from non-ED and other medical disciplines that you might have experienced. And there's also a huge focus on teamwork in the ED. You need to be able to work effectively and responsibly with other people, often in really challenging situations. Apart from becoming a specialist in emergency medicine, there's lots of other pathways to different subspecialties and skills beyond that. ASIM itself has formal dual training pathways for paediatric emergency medicine and intensive care medicine, and we're also launching a diploma in pre-hospital and retrieval medicine, which will be able to be taken in conjunction with your FACEM training. Beyond that, there's plenty of other pathways, including sports medicine, event medicine, rural and wilderness medicine, there's public health disaster management, and there's also things like academia and research. The University of Western Australia actually has the largest ED research department in Australasia. In terms of lifestyle, I'm not going to touch on this too long because Thomas and Rebecca will probably be able to give you a bit more information on this side of things, but you can definitely have a good work-life balance as an emergency medicine specialist. There's the opportunity to work part-time or flexible hours, which is great if you have a family, want to have kids, or have other family commitments. The shift work also means that you can sometimes have weekdays off and potentially take mini breaks without having to use up all of your annual leave allowance. And the FACEM qualification is also quite well respected, not only in Australia and New Zealand, but also overseas. So it provides you the opportunity to combine work and travel, see the world and earn some money at the same time, which is a bonus. So the FACEM training program, it's a 5-year program designed to be 1 year in provisional training and 4 years in advanced training. But you get up to 12 years to complete the entire program. So that allows more flexibility, part-time training down to a minimum of 0.5 FTE, and you're also permitted to take up to 3 years interruption to training during that time. As part of the training program, there's up to 18 months non-ED training, and that can really be whatever you want it to be within reason. There's, if a placement's accredited by another college, then it will generally be approved for FACEM training. And you know, outside the box, you know, further afield than that, you can prospectively apply to have it recognised. So there's lots of scope there. There's also 6 months in critical care, which is either anaesthetics or intensive care medicine, or you can do a combination of both. So you can do 3 months in each. So you really have that flexibility. The other thing about ASIM training is that you, as a trainee, have the opportunity to find your own placements. We don't put you in placements. So you have the flexibility to move around between states and New Zealand and also overseas if you want to do that. This slide just shows you a broad overview of the training program. On the left side there's the training time requirements that I've just mentioned. On the right side is the assessment requirements. So provisional training, you have in-training assessments on a 3-monthly basis and structured references from your ED placement in that first year. And during advanced training, you complete your in-training assessments still on a 3-monthly basis, and you also complete workplace-based assessments when you're in ED rotations, and they're normally completed at a ratio of about 1 month, but we encourage you to do more. Excuse me, the application process itself. 2 years ago, we introduced a standards-based selection process to actively select doctors into the FACEM training program. So it's an online application form that comprises of a structured CV, nominated references, and an institutional reference. The structured CV focuses on your training experience to date, courses that you've completed, any other training, any extracurricular activities that you've undertaken. Nominated references need to be 4 referees from your latest ED term. Now, they'll complete individual online references, and that's just their personal opinion. We also ask you to provide the details for the Director of Emergency Medicine, and they'll facilitate an institutional reference, which they collaborate with other senior personnel from the department to get a real 360 well-rounded view of your experience in the ED. There's no interview and there's no entrance exam, which compared to other medical colleges is, makes it quite easy. But this year we have introduced a situational judgment test, which assesses non-medical attributes, which all applicants do have to sit. For the eligibility requirements, there's a few, there's not heaps, but they all have to be completed by the application closing date. So there's more detail on the website for all of these, but one of the first ones is have an Australian or New Zealand primary medical degree, or the AMC certificate, which is the pathway for international medical graduates. We also need you to have approval to work or train in Australia and New Zealand. Now that basically means citizenship or permanent residency, but we also accept applicants on visas. So as long as your visa allows you to work and live in the country you want to train in, that would be fine. We also need you to have full general registration with either APRA or MCNZ as appropriate. We can't accept provisional registration or limited registration. And there are some term requirements as well. So we need you to have completed 8 weeks in ED, in or after PGY2, in Australia or New Zealand within the last 2 years. Excuse me. And we also ask that you have 2 full terms of minimum duration 8 weeks in 2 different disciplines other than emergency. So that can be any 2 non-ED terms, and that can also in turn include rotations completed in the intern years. Just to give you an idea, this is our schedule for this year. So we have 2 rounds of applications. There's not really any difference between them. Everyone will still start at the start of the relevant medical training year. That just gives you an idea of how long you have to complete your application. This year we did open 3 weeks earlier, just because of the COVID crisis, to try and alleviate the pressure on applicants and referees. But generally it's sort of a month or so between each next step in the process. So what can you do to prepare? The main thing is just plan ahead. Make sure that you've got the terms set up so that you can meet the eligibility requirements for when you want to apply, and think about finding an accredited DD to work in for the first year of training. You also want to think about your referees, so who might be suitable, let them know that you're planning to apply, and keep in their eyesight. Make yourself well known as much as possible in the ED, because some of them will probably be providing your references. Beyond that, it's worth keeping in touch with supervisors at your hospital, other FACEMs, other trainees, talk to them, get their experience with the training program, and you might want to consider asking someone to mentor you to get that real hands-on specific experience that will help you in the training program. That's it from me, so I'll hand over to Matthew.
Thanks, Heather. I will just bring my screen up to share. Apologies, everyone. I'll just get it to the right slide. Yes. So hopefully everyone can see that now. It's just a slide stating that I'm the manager for the national program. So the national program receives funding from the Federal Department of Health. So we receive about $25 million a year. So as I said, we receive funding through the Department of Health. The programs we look after have been funded since 2011, and the current funding round was due to expire at the conclusion of this year, but we've just received confirmation from the Federal Department that there'll be a 1-year extension, and we're hopeful that we'll receive another 5 years worth of funding for 2022 onwards. So we're currently in negotiations with the department regarding that. With the specialist training program, as you can see, there are 5 separate pathways that are administered by ASIM, and I'll go into them. I won't highlight the Tasmanian project too much because we want to keep you guys in the Northern Territory, but that's just another option. And with the STP, there's 13 specialist medical colleges that administer STP for their specialty. So the STP posts aim to improve the emergency medicine workforce quality and distribution through enhancing specialist training opportunities. So these are in addition to what is funded by the state or territory jurisdiction, and they're to meet needs. Now, currently we have quotas where we've got to have 66% of the posts in rural and remote areas, but that will increase with the next round of funding. And currently in the territory, we have 4 posts at Alice administered through Alice Springs. So 3 of them are at Alice Springs Hospital and 1 at Tennant Creek. So the positions for STP can be in many disciplines. So they can be funded for critical care, rule and rate training, ultrasound, medical education and retrieval. So some of the posts can be funded to for you to complete the pre-hospital retrievement diploma that Heather was talking about. So you can receive another qualification under that as well. There's also anaesthetics posts. So as part of the specialist training program, you do have to do a critical care component so that STP can actually also fund placements from another college as well. We've also got the integrated rural training pipeline for medicine. So there's 100 of these posts around Australia, 12 of which are administered by ASIM, and there is 1 in the territory out of Royal Darwin Hospital. And the aim of this is really to have trainees do the majority of their training in rural or provincial locations. So for the Royal Darwin post, there is training conducted obviously at Royal Darwin, but also through Alice Springs and Tennant Creek. But there is flexibility for you to do positions in other areas as well as is seen fit, and that's at the discretion and discussion with the employing body, which is Royal Darwin Hospital. With all these positions, ASIM administers the funding and the training, but the employment is through the individual hospital. So for no positions, ASIM doesn't arrange employment. It really is the training body. It's up to you to have discussions with those individual institutions where you wish to work and train. We also administer the emergency department private sector clinical supervision. So currently there's no positions in the territory, but this is really to allow trainees to train in private settings and get that experience in the clinical setting. And it's an incentive to also have private hospitals employ trainees other than consultants. And we have really good occupancy in this. A lot of trainees will try and occupy the posts while they're preparing for exams because they have one-on-one opportunities. But that's the same with the STP and the IRTP as well. Then we look after training more specialist doctors in Tasmania. We will skip over this, but it really is just to get more trainees in Tasmania as they're very reliant on locums, so to reduce the need for locums to support the workforce down there. As medical students and first year doctors, you can actually be involved in what is called our emergency medicine and education training program. So there is a hub based out of the Northern Territory, out of Alice Springs, and they do a lot of work in Tennant Creek, and it's to assist with the promotion of doctors enrolled in the emergency medicine certificate and diploma, but to also provide emergency medicine training to non-FASM trainees and non-FASM specialists to upskill them in emergency medicine procedures. So it's good to get involved in this if you have the opportunity, if you're based at either Alice or Tennant for a rotation before you join the FASM training program, just to really give you a taste of what it's all about as well. And you can complete a certificate or diploma through this pathway as well. So there's funding for the supervision of that. So there's lots of activities performed under that. And as I said, we encourage medical students to get involved as well. This program used to be specifically for medical officers and GPs. However, it was acknowledged by ASIM and the Department of Health that the delivery of emergency medicine, particularly in regional, rural and remote areas, is a multidisciplinary approach and a team approach. So we wanted to make it as realistic as possible. So incorporating doctors, nurses, paramedics, medical students, whoever would be involved in the delivery of emergency care. One of the programs, as I said, which was piloted under EMET is the Emergency Medicine Certificate and Diploma. So both these programs are something good for people if they're unsure whether they want to specialise in emergency medicine, to give them a taster. So we currently have the Emergency Medicine Certificate, which requires you to do some in-hospital assessments, some supervised procedures, etc. And same with the diploma, which currently requires 12 months ED plus 6 months critical care. To align our certificate and diplomas with the pathways through ACREM and RACGP, we are changing the emergency medicine diploma to a 12-month qualification, and we are introducing an emergency medicine advanced diploma. So the advanced diploma would be for those doctors on a rural generalist pathway looking to ultimately be the lead at a hospital, to provide them those non-clinical skills that are required to be in charge and clinical lead of a hospital. For this, we do have a lot of people on the either RACGP or ACREM pathway. So if you do want to be a rural generalist, there still are opportunities to get a qualification through ASIM. And if you're unsure whether the FASIM training program is for you, this, as I said, this is a really good taster for you to get into the program and see if it really is for you or not. Sorry. Next slide. And that's really it for me. So those are the programs that are funded under the rural training, the national training program. So I'll hand over to Thomas now, who's one of our trainees.
Hi everyone, my name's Tom. Good to be here with you tonight. So I just thought I'd give a little bit of background about myself. I'm an advanced trainee with the college. I'm PGY8. I'm a father and I'm married. In my previous life, I was in the military. While I was in the Air Force, I deployed to Afghanistan and I completed a fellowship in general practice. When I was overseas in Afghan, I had the opportunity of working in the US with the US hospital in Kabul and saw how they did emergency medicine. And when I came back, I started to get interested in emergency medicine. And I've spent the last 7 years or so in the territory. And I've worked in Alice Springs ED and Catherine ED, and now I'm in Darwin. And I've been in Darwin for about 18 months. So why Darwin? When I was looking at coming here, I sort of wondered how busy Darwin was. And this is back in 2018, and I was looking at some stats, looking at the presentations that come through Darwin, and it's about 71,000 presentations per year back in 2018. And if you compare that to, say, Royal Melbourne, they get about 78,000 presentations per year. So I think it's a busy place. It's comparable to a major quaternary centre in the heart of Melbourne, and that appealed to me. I guess the other big thing would be it's got a very supportive trainee culture. We've got a lot of DMTs. There's a lot of consultants on the floor at any one time. There's a good mix of junior registrars and senior registrars. You've got 4 hours of dedicated teaching each week. There's different streams for those sitting fellowship exams, primary exams, and then another stream for those who aren't sitting exams. There's great access to other rotations. So I'm currently doing intensive care. That's a 6-month rotation here. I'm 4 months into that. You've got access to anaesthetics. You've got access to Care Flight, which is our aeromedical retrieval service. And also other medical rotations, so cardiology, renal, PAL care. And you can also do surgical terms as well. I guess the other big draw card was the Aboriginal and Torres Strait Islander patients that we work with on a daily basis. I don't think there's any other centre in Australia that sees as many Aboriginal and Torres Strait Islander patients, and I think we see them, when they're severely unwell. So if you enjoy working with Aboriginal and Torres Strait Islander people, then this is really the epicentre for that kind of medicine in Australia and probably the world for that matter. I think there's a few other points I'd like to mention. There's really good opportunities for mentorship. So I currently mentor a resident doctor, and then I'm also currently mentored by a FASIM, so an emergency medicine consultant. And I think that just gives an opportunity to learn how to teach people, how to help people through the program, and then also be taught by specialists in the field. We've also got two of our FACEMs on the board for the college. So Dr. Rebecca Day and Didier Palmer are both on the board. I'm not aware of any other hospital in Australia or New Zealand that's got two consultants on staff who are on the ASIM board. So we might be geographically isolated from most places, but I still think we're extremely well connected to the college. I'm also the NT trainee rep, so registrars can come to me with ideas or suggestions or problems, and I raise them at our regular 6-monthly meetings at the college. We're also affiliated with Flinders Uni, so I'm an associate lecturer with Flinders. A few of my colleagues also lecture, and that's a great way to give back to medical students, and also a good way to meet your future interns and residents. So it's a nice relationship we have with Flinders. There's really good paediatric exposure in Darwin, so it's a mixed ED. So from day one, you'll be seeing babies and kids and teenagers, and that's in contrast to some of the bigger centres down south that only see adult patients, for example. I think there's plenty of leadership development opportunities, and I think leadership's a skill that you don't just learn from a 2-day course. It takes years to develop good leadership skills. And as a junior reg, there's plenty of opportunities, and then as you progress through the program, they get more and more frequent. There's also an opportunity to do work at Palmerston Regional Hospital, which is a satellite hospital. That's a really good way of getting experience in referring patients to tertiary and quaternary centres for advanced care, and what it takes to transfer patients. So that's I guess about everything that I wanted to cover. I guess I'd hand over to Dr. Rebecca Day if you're here.
Yeah, thank you very much, Thomas. It's Olivia. Sounds like you've had a very exciting career journey to get to where you are at the moment, and are still looking forward to lots of exciting opportunities. We do have Rebecca Day on, who's from Top End Health Services and co-director of the emergency training up here, and I might hand over to her if she's able to hear and see us and speak.
I am Olivia. Thank
Great.
you very much for the introduction. So my name is Becky Day. Like you said, I'm one of the FACEMs up here in the beautiful tropical Top End. I'm the Director of Emergency Medicine Training, and I have a couple of ASIM roles as well. As you can tell by my slightly dodgy accent, I'm not actually from Australia, so I got to Australia back in, a long time back, 2007, when I was at PGY3. And I actually spent the vast majority of my training time in the sort of white middle class, health literate, shiny towers of the North Shore of Sydney. And I had a really beautiful training experience there, but I just felt like there was something missing. So I went off to Tamworth and Broken Hill and a few other places to get a bit of remote experience. And then when I became a consultant in 2014, I was just looking for a challenge and a change and for a tropical adventure. So I headed off to Darwin. When I arrived here, it was a culture shock, it was a weather shock, it was a pathology shock. It was wet season, and the day I arrived, I have never seen rain like it. It was insane, and I thought, what the heck am I doing here? I went from thinking, okay, I can survive 6 months here, it'll be okay, to within a month, I just knew that I wouldn't be leaving anytime soon. And I've been here for 6 years now, and I love the place, I love the people, and I especially love the medicine. So the emergency medicine in the Top End is just insane. The pathology is mind-blowing. We have got some of the most wonderful infectious diseases you could ever wish to meet. We've got melioid and Acinetobacter and TB and every flavour of sexually transmitted infection you could wish to come across. We've got wonderful critters. We've got jellyfish and crocs and snakes. We've got wonderful, wonderful trauma up here with I have on occasion called us the being punched in the face capital of the world, because we get probably more facial trauma than anywhere else. And we get really sort of high rates of MVAs and penetrating trauma. I think I've been involved in 3 thoracotomies in the last 12 months. So it really is challenging. And even those things that are considered sort of super exciting medicine, even aside from that, we get really sort of advanced, untreated and late stage chronic diseases. It's not unusual to see patients here with potassium levels of 9, you know, things that I thought were incompatible with life when I worked in other places. So the medicine really is fantastic. And Tom's already sort of mentioned that the Indigenous health up here is really interesting and really challenging as well. And don't get me wrong, it's really very sad that we have this huge health gap, but it certainly is a place where you can make a difference with that, at the same time as having a wonderful, wonderful learning experience. I think aside from that, this is a really sort of small and tight-knit community where everybody knows your name. You have to behave yourself in Darwin because everybody knows everything about you, but that's also really wonderful, because you make a referral to somebody and you generally get a friendly voice on the end of the phone, somebody that you know. We're very collegiate, we're very friendly, and there's a really, really lovely network up here, the Top End Medical Society, who arrange events and, you know, welcome drinks and things when you do get here. Tom also mentioned that it's an opportunity to work in some of the smaller places. So yes, we have Palmerston, but we also have Gove and Catherine. You know, there are people who are going out to do really interesting rotations in much more remote places than Darwin. We've got people who are flying in, flying out, doing attachments to small communities on GP placements. And we've got the ability to send people off on an exciting 6 months to do care flight retrieval as well. So the opportunities really are endless. I don't want to blow Darwin's trumpet too much, but you know, we really have an excellent teaching program in ED. We're currently running sort of 5 streams of teaching, so covering all of the exams, the general teaching, the written, and the Vivas and OSCEs. So we work really hard and we pour a lot of resource into making sure that we get people through their exams, and our pass rates reflect that. We're doing okay. We prioritize the RMOs as much as we do, and the interns as much as we do the registrars. So everybody gets between 3 and 4 hours of protected teaching time a week. So currently our interns get off the floor at 8 o'clock on a Tuesday and they don't come back until after 11. And that's a sort of exciting mix of workshops and didactic lectures and ALS training and all of that kind of stuff. And, you know, aside from the medicine and the teaching and the opportunities that you're afforded up here, we really have to say something about Darwin itself. So, you know, in the last month, I have swam in waterfalls, been on secluded beaches, seen some of the best sunsets you'd ever see, eaten beautiful Vietnamese food from one of the many amazing markets that we've got here. Camped in a national park, lit a fire on top of a cliff and cooked sausages as the sun goes down. You know, it really is a wonderful place. It's super laid back. So, you know, rather than sitting in traffic for 45 minutes to get 15 Ks in a big city, you can hop on your bike and ride up the Nightcliff foreshore, over the bridge, the beautiful blue water, through the reserve, and just pull up at work ready to go. So it really is quite idyllic. Yeah, you'll definitely work hard if you're here, but you'll be rewarded with so many things. So I can't say enough good things about the Top End. So that's pretty much all I have to say. Oh, the weather. Sorry, I forgot about the weather. So 5 months of the best summer days back to back that you could ever imagine. Followed by 3 months of the worst weather you could ever experience in the build-up, but I promise you it's worth it. Yeah, and I'm happy to take any questions.
I think you've definitely sold Darwin, Rebecca. Maybe not the build-up, but And I was, as you were speaking, I was reflecting on my first few days in Darwin. I too arrived in the middle of a monsoon, and having grown up in Alice Springs, I'd never seen that much water ever, let alone in the space of 5 minutes.
Yeah, it's just terrifying when it first happens, and you just see it. It looks like the world's going to end, but it's usually followed by beautiful sunsets and lots of animals, and it's good stuff.
Yes, so everyone should come here for the Darwin lifestyle. Yes, I was just swimming in my pool yesterday, and it was a bit chilly by my standards, but I'm sure those of you who are not in the top end are not thinking about swimming at the moment. I don't feel like I need to sell living and working in the NT. Thomas and Rebecca have done such an amazing job of doing that and talked about all the wonderful pathology, medicine, things that are offered in emergency training up here. I do have a question for Thomas or Rebecca. From a college point of view, what sort of non-clinical advocacy and support do members of the college get from your perspective?
We've got some pretty sort of active programs up here in ED in terms of both each trainee has a DMT, so as their clinical supervisor, but they also additionally have an opt-in option for a mentor, and that's both a FASM mentor, and we also do some near-peer mentoring as well. In terms of links with the college, the DMTs are very active in talking to the college about any issues. I'm the regional censor for the Northern Territory, so we're always happy to try and help, where needed. And I think the consultant group and the registrar group as a whole up here really recognise that a lot of people are away from home. They are potentially isolated from their families, and I think we recognise the need for your work colleagues in some way to be not like your family members, but to provide you with some of that support that you might be missing. There's also there's a doctor's health group that can be accessed up here. There's confidential sort of employee assistance programs. So there's all sorts of additional support for those that need it.
Yeah. Anything from you, Tom?
Yeah, so as I mentioned before, I'm the NT trainee rep for any of the ASIM trainees. So, if they don't feel comfortable going to their supervisor, they can always talk to me.
Yeah.
And then we do encourage, everyone to have their own GP and or psychologist. I think particularly when you're starting out, it's, there's a lot of anxiety when you're junior reg and you often sort of doubt yourself. But, I think that's a good opportunity to talk to some of the senior regs and say, hey, how do I best approach, the early stages of training.
I concur. Everyone should have their own GP. Being a GP myself in Darwin, there's plenty of GPs around who are happy to be doctors for doctors in the Northern Territory. So you can look them up. Is there anything else from a college perspective, Matthew or Heather, that you offer that you'd like people to know about other than those things?
I guess it's Matthew here. I guess just from a non-clinical perspective, the college is very much into advocacy, so around climate change, same-sex marriage, lots of other things that I'm sure Bex is aware of from a board perspective as well, but being involved with other colleges. So we had a mental health summit with a psychiatrist, and there's been some really good papers come out of that as well. So working in a very multidisciplinary way with the other colleges as well.
Thank you. It sounds like there's lots of support that's happening both at a college level and at a local level for everybody in the NT who wants to embark on training. Tell me, Rebecca, who should any potential trainees, like interns, PGY, pre-vocational doctors, or any of our final year students, who should they contact if they're interested in emergency medicine in the Territory for some local advice?
Yeah, absolutely. I mean, there's myself, Lizanne Corning, and also Mark Ross, the 3 directors of emergency medicine training. I think it's important to note that you can't actually sign up to emergency training until you've completed 2 full PGY years in the new program. But I think if you have an interest, it's really important that when you are looking to your intern and resident jobs, that you express a preference for emergency, because so that the medical administration and the people who allocate the rotations know that you will likely need additional emergency rotations to allow you onto the program. There are certain sort of time restrictions, and that you have to have done a minimum amount of emergency to be able to apply. So it's important to flag that you're interested in emergency medicine. But any very specific questions, they can come to me, and I'm happy to put out my my email address there for any prospective ED trainees.
And for those of us who are thinking about training in Central Australia, were any of those contacts for Central Australia as well?
The person in Central Australia to contact would either be Anna Fairbairn or Shane Tan is the Deputy Regional Censor. So I think Anna does recruitment, and Shane as Deputy Censor. But your first port of call for anything training at any given hospital is the DMT, and usually they're very open and easily accessible people. I think the college does actually keep a list of names of DMTs on their website that can be accessed, with I'm pretty sure email addresses are on there too. I don't know, Matt, if you can confirm that or not.
I will defer to Heather to see if she knows that one. Sorry.
I'm not sure.
I'm not 100% either, but certainly if anyone calls the college, we can direct them to the right place. We can give out relevant email addresses and help out.
Yeah.
And trainees could, or potential trainees or junior doctors looking for more information, could just contact their medical education units at each of the health services as well, and they could direct them to the right place as well. And
the ASIM website has just so much information on it. That's actually relatively easy to navigate from the front page of the ASIM website. So there's a little tab at the top that says training, and I think you click that tab and it says something like how to apply, and it will give you all of the the necessary sort of steps you have to go through, and how much time you have to have done, and the sort of the criteria you have to meet. So it's very easy.
So how much of your entire training can you do in the Northern Territory if you embark as a ASIM trainee?
That's a really good question, because with the opening of Palmerston, you can now actually do all of it. Wow. I have to say, I wouldn't necessarily advocate for that. I think it's actually very important that people go to a diverse range of places to really see the full breadth and depth of emergency medicine. But if you so wished, and you planned out your rotations, you could actually do all of your training in the Northern Territory now.
Sounds like a pretty exciting advancement for some people, but as you said, there might be things that you want to do elsewhere. What sorts of other sort of advanced or specialty training areas are there opportunities to do?
So we have got a whole lot of external rotations that are accessible, everything from medicine and surgery, although not a lot of people tend to do that. We've got anaesthetics and ICU. We do have a little bit of a bottleneck for anaesthetics and ICU at the moment, but usually people who are staying around for sort of 2-3 years, we can get them through their crit care. We've got access now to paediatric rotations for both registrars and RMO level trainees. We have care flight retrieval, and we can even set up some special skills rotations. We've had people sort of go to Catherine and do special skills on sort of prior prospective arrangement as one-offs, although I'm not sure that's quite as easy to do at the moment. And yeah, so there's really quite a breadth of things that you can get your teeth into.
And it was mentioned before that from the top end you can do rotations out to Nhulunbuy and Catherine.
Yeah, you can, and they're really wonderful rotations to do. I mean, working in Catherine and Gove is just such a treat. It's just a different world altogether. They're currently, because of the limited FASEM numbers in those sites, not accredited for training. But I don't think that should be an impediment, or, you know, I don't think that should stop people going and doing those rotations, particularly as a pre-ASIM trainee. So in your first couple of years as a doctor, when you haven't yet signed up to the program and you're not able, it's just such a wonderful time to go to those places.
And Heather might be able to just confirm that from Alice Springs Hospital, you can go out and do rotations to Tennant Creek Hospital as well. And that's part of the EMET program as well, Matthew, is that correct?
So thanks, Olivia. So EMET really is not intended for FASEM trainees or FASEM specialists. So for those wanting to go on the rural generalist pathway, who are doing the diploma or certificate with ASIM, it really is with that. But we do have an STP placement at Tennant Creek. So generally we send, we'd like advanced trainees to go there. And as part of EMET, there is a FASEM from Alice that goes up to Tennant 2 days a week to support the EMET training program. And they're really supernumerary up there, so you can get a lot of your procedures done and there's a lot of support up there. But we'd encourage a more advanced trainee to go to that post rather than a provisional trainee.
Okay.
Yeah, I'm not sure about the where you can rotate from specifically, but certainly for pre-vocational prospective trainees, we would encourage you to go out and get a real diversity of experience, because that's really going to help, even if it's non-ED, it's really going to help you in your ED career. And certainly rotations out to rural sites are very well regarded.
Okay. Thank you very much. I do have another question that's come in. Before applying for ASIM training, you have to have recent ED experience, and you've got to have at least 2 years pre-vocational training before applying. Do you have to have a current position in an emergency department to apply though?
No, as long as you've got that 8 weeks of ED experience within the last 2 years, and that's been completed in Australia and New Zealand, PGY2 or later, that's all we need. So you don't have to be currently in an ED position. You just need to figure out that and getting one lined up at the start of the medical year.
Yeah, great. And Heather, you mentioned referees before. Do all those referees need to be FASEMs?
No, not all FASEMs. They do all need to be from your most recent ED experience. We ask that your turn supervisor is one of your referees, so whether that's a DMT at an accredited site or otherwise just your turn supervisor at the hospital. We would prefer to have a couple of FASEMs on there, but for a fourth referee, we do like to see a senior nurse or a senior non-ED clinician who you may have worked with ED.
Yeah, but all ED referees, yeah? Okay.
Yeah, that's right.
Okay. I think that's all of the questions that I have been submitted, and I can't think of anything else that I personally need to ask. Is there any questions that you might have for each other about the training and the delivery of training in the NT? Or any final comments anyone would like to make?
So it was really to Bex and Tom, just in regards to the current COVID-19 crisis and their experience in the ED, so what that's really been like, and the work that's been involved with other clinicians from other disciplines as well.
Go for it, Tom.
Yeah, I mean, it's sort of a lot of fizzle and no bang with the COVID. I've been in ICU, so there's been endless email trails, endless training, endless PPE donning and doffing, various liaising with ED and other services about patient transport. I think, we've been remarkably lucky in having very low rates. I think I've only really been involved in one severely ill COVID patient who was in ICU. We've had a few on the ward, just admitted for isolation, but weren't particularly sick. So I think, we've been grateful that it hasn't been busy and we've been given time to prepare. But it's certainly very different down south and in Europe and North America and in China. So, yeah, I think grateful and lucky.
I think the other thing is that we will be, if there is a second wave, we've had such a lot of time to prepare. We have a COVID manual, so everybody knows exactly what they need to do. And, it's been very fortunate for us that we had so much preparation time and not very many cases. But I think even though it was a lot of fizzle and not a lot of bang, as Tom so eloquently put it, I like that, Tom. I think it's actually been really good for people to get an understanding of what is needed in a pandemic and the response that is required. And we ran sims, we did walkthroughs, the amount of effort that went into getting ready for what we thought was going to happen was phenomenal. And I think it will only leave us better prepared for when something else happens.
Yes, I agree. As a GP, I think it's been managed very well in the Northern Territory, and the information coming out to general practice from our health services has been very informative and on par. And I'm really glad that it's been lots of fizzle and no bang, to tell you the truth. Yeah. And I think we are very well prepared for any future pandemics. Thank you. Well, it is only 3 minutes left. I just want to thank everybody very, very much for participating in this webinar this evening. It's been very informative for everyone who's been online and listening, and certainly it's opened my eyes to some of the other opportunities that are available in emergency medicine training that I wasn't necessarily fully aware of before. So I'd really like to thank Heather Chapman and Matthew Davies from the Australasian College for Emergency Medicine, and Thomas Van Densink for sharing his journey into training, and Rebecca Day for really selling their NT and our critters and our pathology to everybody out there. We have a quick poll that we'd like all our participants to just answer. It's 3 very quick tick questions. So it should be popping up on your screen now. The panelists won't be able to see this, just attendees. If you want any further information, please contact us at the Regional Training Hub. We will be very happy to get you in contact with any other people and our presenters this evening if you need, and also contact those people that were mentioned earlier, both in the Top End and Alice Springs locally, for your detailed ASIM training or potential mentoring. I will be sharing our details soon, hopefully. There they should be on the screen now. So one last time, thank you, Heather, Matthew, Thomas and Rebecca. And that's us signing out. And this, as I said, has been recorded and will be available on our website in a week or so. Thank you very much and good night, everybody.